dive into the UK's mental health clinical coder. Now, this is a role that I think is often misunderstood. People see it as admin, but it really isn't. It's right at the financial engine of the NHS.
Oh, absolutely. It is one of the most technical and strategically vital functions in healthcare. This is the bedrock of healthcare data. We're talking about the engine that drives financial reimbursement for NHS trusts under the payment by results system.
PBR.
Exactly. So, simply put, if the coding is inaccurate, the trust's income is directly at risk.
Okay, so our mission today is to give you a shortcut to understanding this, what the job actually entails, the intense specialization for mental health, and the very clear career path. So to start, just walk us through that link. How does that translation work actually turn into cash flow?
Well, at its core, the clinical coder is a data detective.
Yeah.
They have to meticulously translate these detailed clinical narratives, diagnoses from patient records, into standardized codes.
The codes mandated by NHS Digital and the WHO.
Precisely. And that coded data determines the classification of what are called healthcare resource groups, or HRGs.
And just for anyone unfamiliar, HRGs are basically the fixed product codes the NHS uses, right? So if a patient gets care for a certain condition, the HRG defines the package of care and therefore the payment.
That's it, exactly. The coder's translation directly determines which HRG gets assigned. And to make sure it's accurate, they have to communicate across multidisciplinary teams with consultants, with clinicians.
So they're not just sitting at a desk, they're actively clarifying things.
They have to. They resolve quality issues, clarify ambiguities in the notes. They're really data quality assurance officers.
Which must mean they sometimes have to challenge a clinician's documentation.
Absolutely. They have to work strictly from the written record, but if that record is, say, vague or incomplete, they must go back and ask for clarification. That takes some real influencing skills.
So given that precision, how does it all change when you move away from, say, surgery and into mental health?
This is where the real specialization comes in. In an acute hospital, coders use two systems, ICD-10 for diagnoses and OPCS-4 for procedures. But in a mental health trust, the focus shifts almost entirely away from procedures. It's all about complex diagnostic coding using ICD-10.
That sounds incredibly challenging. I mean, given the subjective nature of mental health documentation.
That is the core difficulty. Their expertise has to be laser-focused on ICD-10 Chapter 5. That's F100 to F99, mental and behavioral disorders. The subjectivity means a coder might spend an hour debating if a consultant meant, say, moderate anxiety or severe panic disorder.
Because the financial implication is that different.
It's substantial. And they can only code what is explicitly documented.
And the level of detail isn't just a nice to have.
No, it's mandatory. They must get to 4 and even 5 character specificity. So think about psychoactive substance use. They have to differentiate F1X.00, which is uncomplicated, from F1X.05, which is with coma. That tiny difference in detail directly changes the HRG and the funding.
That technical depth just proves this is a high-value skill. So let's talk about the career path for you. A trainee clinical coder starts at Band 4, entry salary around £27,500. But the career accelerator, the real game changer, is getting that accredited clinical coder status, the ACC.
Right, by passing the National Clinical Coding Qualification. And achieving that ACC status is immediate financial validation. It's a guaranteed move to Band 5.
What does that mean in terms of salary?
You're starting at over £31,000, and you can progress up to nearly £38,000. So you've leveraged your qualification into a significant guaranteed pay rise. And for senior roles, auditor or trainer, you're looking at Band 6 or 7 with salaries getting close to £50,000.
And the market premium really becomes clear when you look at the contract market outside the permanent NHS structure. Our sources confirm the median daily rate for a highly accredited contractor is a striking £300.
Wow.
Which, if you annualize it, translates to roughly £72,000. That's what trusts will pay for that expertise when they're in a bind.
And that just confirms the high costs they face when they can't rely on their own internal accredited specialists. It's a national shortage.
So what does this all mean for you? It's a technical role. It offers guaranteed progression based on accreditation, and that national shortage means robust career opportunities and excellent financial rewards.
And if we look at the bigger picture, people always talk about AI being a threat to data entry roles. But the high salaries for those senior Band 6 and 7 auditors and trainers, that confirms the core human function is irreplaceable. Data governance, quality assurance, and that complex interpretation of ambiguous clinical notes, that will always be a highly rewarded professional skill that technology, for now, really struggles to replicate.